We'll give folks maybe like another moment to sign on, and then Dr. Brewitt will take us away with the mindfulness.
Welcome, folks. All right, welcome, folks. We're really glad to have you. So we'll get started with a mindfulness activity as always. So if you'd like to, you're welcome to turn off your camera. That's up to you. Today we're going to do a mindfulness of sound activity. So you can put down anything that you might be holding. You can take a comfortable seat or standing, whatever you prefer. And you can go ahead and close your eyes and take a breath. And then I invite you to tune into any sounds that you can hear in your environment. And you might use a strategy of mental noting and say to yourself, sound, each time you hear something. Your attention will wander. You can do your best to bring it back to what you hear. Continuing to pull your attention back to sounds. When you're ready, you can bring your attention back to this space. Thanks for engaging in that. Folks who are able, we love to see faces on cameras. It helps us build our community and understand that not everybody is in a place where they're able to do that. And I'll turn it over to Dr. Heck.
Great, thank you. So today I am thrilled to introduce our topic, which is From Punishment to Support, School-Based Substance Use Strategies. And this is co-led by our CalMap Hub member, Dr. Evan Holloway, and our champion partner, Marisela Sanchez. So if we go to the next slides. Just a reminder that for primary care providers, medical providers, CalMap offers curbside consultation during business hours, and also some resource support navigation. Go to the next slide. We've got some really cool upcoming always free continuing education eligible education offerings. So we've got a webinar coming up on motivational interviewing and our next school echo. So next month at the same day and time, we'll be talking about suicidal ideation. And then on the 4th Thursday of the month at noon, we have our therapeutic skills echo. And today, or not today, this month, it'll be focused on interaction cycles, attending, and praise. And we don't have any financial interest to disclose. You can see a bit about our funding from HRSA and DHCS.
All right, and then we can take it from here.
Got it? Okay, perfect.
Thank you, Dr. Hack. Appreciate that.
Dr. Holloway, the very top of the slides are a little bit cut off.
Oh, okay. 1 second. Try that one more time. Was it on all the slides or just that last one?
I noticed it most on the last one.
Okay, let me try this one more time. Okay, is that better?
Yes. Great.
Mm-hmm. Okay, great. Thank you, Dr. Hack, for the introduction. Just wanted to briefly reintroduce myself a little bit. So I'm a clinical psychologist, part of this hub team, trained as a child and adolescent psychologist, and also specialize in working with kids involved in the legal system and those who are at risk for involvement, and really interested in how to improve service delivery systems, especially for substance use. And so giving that context that I work for CalMap, and today we're really excited because we have a champion partner who we met actually about a year ago at in our school echo. And so I'm going to let you introduce yourself, Marisela.
Yeah, Marisela Sanchez. I'm the assistant director to this wonderful team, mostly pictured here, our health, safety, and wellness department. We are in a TK through 8 school district, Panama-Buena Vista Union School District in Bakersfield. And I'm just really proud again to celebrate. We have a team within our department of 24 credentialed school nurses, 22 of whom are dedicated to supporting our school sites. And yeah, so throughout this, I'm happy to share how this amazing team has really been instrumental in supporting our district substance use intervention efforts.
Awesome. Thank you, Marisela. So with that, our learning objectives are, we hope that by the end of this talk, you'll be able to understand 2 benefits of substance use screening, brief intervention, and referral to treatment, which we call SBIRT, and how that could be applied as an alternative to school suspension, giving a lesson of how that has been applied and some of those results. And then for you to be able to identify 2 barriers as well as 2 facilitators to how you could implement a similar SBIRT protocol in your school. Finally, be able to start thinking about developing your own alternative to suspension protocol. So to get us started, you all are the experts, right, working in schools, and so would like you to share, how does your school district respond to substance use? And that's intentionally kind of broad. You might think about punishment, you might think about services being provided or not, restorative practices. So please feel free to unmute yourself and share. And if you're not able to, please throw it in the chat. So how does your school district respond to substance use right now? Don't be shy. Anybody? You could also say we're not really responding to substance use. That's a fair answer if that's what's going on as well. Okay, I'm gonna take that people are still chewing on that. Okay, there we go. Some respond with suspension. Yeah. So it's not too late to enter your answer in. I'm gonna go ahead and move on to the next, but if you're still able to respond, we'd love to see that in the chat. Okay, I'm going to review, this is some data from the school district where Marisela works. And, we were kind of understanding some of her motivation for attending our school echo last year. And so in their school district, they found that there was minimal intervention for students who were suspended due to substance use or things like possession of a vape pen, for example. And disproportionately, there were effects on students of color and those with disabilities. Those suspensions relating to missed instructional time, and which had impacts for both the school district, less money, right, coming in for every day that those students missed, as well as more effort to try to help get them caught up with academics. And then individually for students, they were not getting all the academic support that they could because they weren't in school. And so the school district concluded that repeat suspensions might suggest some unmet behavioral health needs. And this is on the left, there's a chart. You can see that the school district was in, according to the State Department of Education, was in the yellow range, suggesting that they could see some improvement in terms of how many kids were being suspended. And again, especially over suspending more kids of color compared to white kids. All right, Marisela, I'll pass to you.
Yeah, so in thinking about, where we were in the yellow phase, so as a district leadership team, we acknowledged that we really needed an alternative to suspension. We didn't have a clear how, but one thing that was definitely powerful and noted is how many of you guys have all heard this phrase, we've always done it this way. So that has very powerful pull on people's motivation. And so it's also important to identify this as a barrier to change within school districts. And so mindsets often keep us in the stage where there's resistance, unawareness, even in the face of clear data and research. So the goal really initially was to shift that narrative even when the new one is not as familiar, compelling. And so that's real work that we really started. What was actually motivating us to move the needle? And that's really where change, began with that question.
And so recognizing that they needed to do something differently besides sort of a punitive automatic suspension approach, one of the solutions that Marisela learned about last year was the SBIRT model, and thinking about how to apply that as an alternative to suspension for substance use. So we have a talk, we got a recording on this. I'll refer you back to our CalMap page to go more in detail on SBIRT, but I just wanted to preview it here. So SBIRT stands for screening, right, and identifying all use using evidence-based standardized brief screeners. I include a couple of here that pediatric primary care providers might use, like the heads and the shades, but there are also some more specific standardized screeners like S2BI and the CRAFT. And then brief intervention. And why do we use that? Because people, including kids, only change when they decide to. And so brief intervention is provided through brief advice or motivational interviewing. And then once we identify someone who might benefit from treatment, we need a place to refer them. And this is only whenever brief intervention isn't enough, and really whenever there's a sort of a more moderate to high severity substance use that we're concerned about. And last year, and in follow-up consultation with Marisela, I really highlighted this, that the referral to treatment is the part where things can really fall off because there might be a delay in getting someone access, and it's hard to find good treatment providers. I also want to give a shout out to my colleague, Julie Yannick, who helped really consult in problem solving how to overcome this barrier around referral to treatment. So after the school echo last year and then through some consultation, Marisela's team developed this beautiful protocol. It's been slightly tweaked over the last year. But broadly, this is kind of what they came up with, right? And so we're presenting this as a model that you can use almost directly. This is one of our resources that we have to share, or you can think about how to modify this for your district. I'm not going to go into every single step, but basically whenever a student is identified with a substance use or a vape concern where they would have been suspended automatically before, now they're being referred to do the S2BI screening and having a conversation with a school staff, including assistant principals, school nurses, to identify if this is a more kind of low risk, potentially some normative experimentation behavior, or someone who might actually really need to benefit from treatment. Marisela, is anything you want to add, or I want to pass it to you?
Yeah, no, I just want to quickly highlight that for any school districts interested in, modifying some of this work or adopting it, this work lives within your MTSS structure. So your teams, your framework within that system, that is where substance use intervention really lives in. And that's really where we, trained and elevated and kind of drove it home. So this is in alignment with all the other existing restorative practices you may have in your district. So it takes us into this case study that, we have here. So in this scenario, and again, we are a TK through 8 school district. So while we had just established substance use counseling services at the junior high setting, we also were getting more and more frequent calls in regards to elementary case settings. And so this scenario here, there's a 6th grade student initially suspended for vaping, getting caught at school and possessing a device. And so using and following this SBIRT model after several consultations with Evan and his team, we were able to establish a protocol and put in place and really, again, work with our school principals that were very beautifully transitioning into providing intervention and very accepting of it. So after 3 sessions in this scenario with the school nurse, we were able to identify using this evidence-based screening tool, student was actually high risk and was appropriately referred to treatment. So that is still, again, a student willing to engage in a negotiated plan was a huge celebration to begin with, to really identify the root cause that would have otherwise been missed. So this case just really highlights the effectiveness of early intervention that, traditional elementary school districts may not have in place.
And Marisela, I just want to add on that you also said for this case, this was a student where this ended up being an opportunity to build a relationship and learn more about some of the other things that were happening in the home, some other social determinants of health and challenges they were having. So kind of opened the door to provide some other supports for that family as well, right? This is that kid?
Absolutely. Yeah.
Awesome. Okay, so that we wanted to give that example of like what that could look like for an individual student. But we also want to give the broader data about what the impact was in Marisela's school district through her team's incredible work. So after implementing this new protocol, they saw 64% fewer substance use related suspensions. So 200 fewer kids were suspended, which still gives me goosebumps. And there was an increase from 50% of students, so 30 students who accessed out of 60 who were referred, to 81%, or sorry, 81 students who access services out of 92 who were preferred. So that's a huge increase in students who are receiving evidence-based treatment after implementation of this program. Increase in service access, decrease in suspensions, which is huge. And so I think this really highlights that this interdisciplinary collaboration, which has just been an honor to be able to work with you, Marisela, that this really facilitated the implementation of SBIRT and your creativity in thinking about how this could be used to reduce suspensions and increase access to care. Preventative care is really amazing. Okay, pass back to you.
Yeah. So yeah, some of the feedback and a lot of school nurses. I'm a registered credentialed school nurse by degree, and it is not something that we're commonly built. Our capacities are built around. So establishing protected time to train, to role play, model for some of our team to help them to be comfortable to engage in what that brief conversation. And so really, the way that we try to frame it is how to have an evidence-based conversation with the student, right? And not shy them away from what we really want to get down to is providing that help and support. And then to our other team members within our school districts, supporting, just building the toolbox for our school site administrators, our assistant principals who are tasked with discipline. Again, having this information and the process and that trust that delivering this intervention would put their role to support rather than discipline, again, has just fostered the stronger relationships between students and staff so we can get down to the root cause and provide that intervention.
All right, so what does the district suspension data look like now? We talked about the reduction in school substance use related suspensions. That's only a portion of the overall suspensions, but that decline in substance related suspensions has impacted the overall decrease and helped move the school district from yellow to the green, according to the State Department of Education's sort of report card. So they've got improved metrics with the state. They're not losing as much money for having students out of school. And despite, and I'll speak for you what you described, Marisela, that where you work is a fairly conservative area, and there was a lot of skepticism. But even with that, neighboring districts have learned about what you've implemented in your district and are now really interested in learning more. And you're being asked to go present on this model in a lot of neighboring districts. And so I think that's a really beautiful thing and really speaks to the importance of collecting this data so that you can show, what's working. That is really how you sell it. Okay, so now we're going to talk about how you can implement a similar alternative to suspension protocol where you work. I don't know if you're familiar with the readiness for change model, or sometimes called the trans-theoretical model, but we use this to think about where people are at in terms of being ready to make a change in their behavior, especially health behaviors. And this is really central to substance use treatment, motivational interviewing, as well. But we've thought about, as we've kind of tried to learn what the lessons are about why this has worked so well in your district, Marisela, is to think about the readiness for change for schools, right? And so at the beginning, school district was in this pre-contemplation stage, kind of unaware, maybe, there might be some resistance to rethinking zero tolerance policies or punitive approaches, and moving to the right towards contemplation, some awareness and consideration that, hey, maybe we could be thinking about doing something different using an evidence-based strategy like SBIRT, preparation for that, and then action. And so along the way, I had the honor of continuing to consult and think about how to respond as your school district moved through these stages. So we don't have time to get into all of these, but we thought we'd start with this pre-contemplation stage, right? And so this is when the district might be unaware of some evidence-based substance use prevention models like SBIRT or other alternative disciplinary models. There might be a strong belief in zero tolerance and punitive policies like there need to be consequences. Of course, we have to suspend or expel. How else are kids going to learn? There might be a limited recognition that student substance use is a behavioral health issue that's been untreated and a place where you can intervene. And there are also, behavioral health interventions in the school setting just might not be a topic of conversation. And so some of the interventions that we kind of, that Marisela developed and we worked together on were presenting data on the ineffectiveness of those suspensions, right? And then after coming to ECHO last year and then being able to share some of the research, here are some benefits of SBIRT whenever it's appropriately, whenever it is implemented with fidelity, I should say. Providing some case studies of successful implementation in other schools. We hope that y'all will leave with at least, a case study that we shared today. And then engaging, finding partners, champions, maybe folks that you work with, teachers, administrators, and also parents in discussions about how to create some insight, right? That you might want to do things differently within your school district.
Yeah, so a concern that I'm sorry, I'm opening my screen. So a concern that we, again, here, validating intervention is an escape from discipline. That is a belief that exists.
And one of the things that we kind of thought about, together, again, we know that like being punitive and just giving a consequence is not going to really change the underlying problem. But we thought about how we could respond to folks who kind of have this concern within the school district. That SBIRT, sitting down, having to talk with an adult and or even just answer some questions could be a standalone sort of consequence or intervention, and can be paired with other interventions to help make sure that this is a learning opportunity where students can learn from this experience. We can learn what their needs are while also making sure that they receive needed support in this sort of window of opportunity.
Another concern that we hear is that students need consequences.
And so the response that we crafted was that, again, this does not remove consequences. There may be other interventions, non-punitive interventions like some restorative practices, right, that could still be, administered, but it does help ensure that those consequences actually lead to behavior change rather than just giving a consequence just for the sake of, doing it because you think that they deserve it or something like that.
And oftentimes staff just feel they have too much on their plate and there's no time for this.
And so reminding them that, this really can take as little as 5 minutes, even fewer sometimes, or up to 20 minutes, and is a good investment and really an opportunity to help prevent repeat incidents. And so you found, Marisela, that these responses ended up being pretty effective, right? You might need to tweak that. There might be other concerns in other districts. Sorry, I didn't mean to cut you off.
No, I was just gonna add to this response that one of the things that we really grounded intervention on is as a school site or as a administrator over discipline, when you take that student and you're addressing that consequence, you already take that time. The best time to educate the student is right in that moment. So just leveraging that moment already in itself wouldn't cut down time. So again, thinking strategically of building that capacity so when they are confronted with that situation, they can naturally ease into the intervention route.
Love that. All right, so how could you implement this in your district? First is it's important to, where we're assuming that your district is ready, maybe they're in the planning, considering, contemplation phase, is to educate staff about the importance of substance use screening, help identify someone who can take leadership, a champion, right, to help establish, monitor, and evaluate what those screening procedures are, the logistics around how it will be done, what instruments will you use, will it be self-report on a tablet, piece of paper, or will it be part of a conversation? To set reminders or sort of, add some structure to help support providers and school staff to screen and follow up. Consider the waste, or confidentiality concerns, right? In California, students who are 12 and older, you do not need parental consent to screen for substance use because that's considered a service. And so they can seek that on their own. But in your district, right, when you're working with elementary school students who are younger, you need to think about how you're going to inform their parents, right, about the SBIRT process. And then finally, prepare for referrals. You don't need a huge list, but it's important to at least have an outpatient provider who you have a strong relationship with, especially someone who can come to the school, so that you're reducing that barrier of sending someone out in the community and having a long wait list for them to get access to care. I think that was a huge, another huge piece here to what you've been able to do in Kern County.
So again, remembering that collaboration is just so incredibly essential, although it may be, difficult, but getting that buy-in and support with other disciplinaries within a school district is the only way that this is really successful. And so remembering if, you are in a position to help oversee, whether it's for your, school community, a grade level, a classroom, or on a district level, if it's not monitored, it's not important. So, and essentially, in order to drive compliance through that continuous improvement model within a, school district, we really have to have systems to ensure accountability, to make sure that staff are doing things with fidelity, because if not, oftentimes what I hear is, well, we tried that and it didn't work. That intervention you proposed, that stuff doesn't work. So really sitting down with folks and going through, that, ensuring that accountability is done. So just thinking again, how this could fit within a framework within your school district, how you can anchor these efforts to really create consistency.